Welcome everyone. I'm Councillor Matthew Winnington, Cabinet Member for Health, Wellbeing and Social Care and Joint Chair of the Health and Wellbeing Board. Joint Chair of the Health and Wellbeing Board. Limited public seating has been made available. However, this meeting is also being webcast to allow the public to attend remotely if they so wish. Please be advised that the public seating area is not in view of the camera used to webcast this meeting. If the continuous fire alarm sounds, please evacuate the room and the public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. May I draw everyone's attention to the fact that this meeting will be live streamed. Everyone speaking via a microphone will be on camera, including those making deputations, of which we have none today. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please can everyone use their microphones? You can bend them towards you, as so. And remember to switch them off when they finish speaking, and you just put them on and off by that button at the front there. So, if people can make introductions. So, we'll start on my left.
Hello, I'm Claire.
Use your microphone, please.
Matt Gummerson, Head of Strategic Intelligence and Research in Public Health.
Anna Martin, Democratic Services.
David Goosey, Chair of the Portsmouth Safeguarding Adult Board.
Alison Lawrence, Board Manager, Portsmouth Safeguarding Adults Board.
Andy Biddle, Director of Adult Social Care, Portsmouth City Council.
Helen Atkinson, Director of Public Health for Portsmouth.
Terry Norton, Deputy Police and Crime Commissioner for Hampshire and the Isle of Wight.
Linda Colley, GP, Clinical Director for Portsmouth ICB.
Councillor Lewis Gosling, the Conservative Rep on the board.
Sharia Hoskins, Executive Dean, Science and Health from the University of Portsmouth.
James Hill, Director of Housing, Neighbourhood and Building Services.
Kelly Nash from Strategy Unit at the City Council.
Sarah Cador, Specialty Registrar in Dental Public Health.
Lorna Reevely, Chief Officer of the Hive.
David Williams, Chief Executive, Portsmouth City Council.
Councillor Susie Horton, Cabinet Member for Children, Families and Education.
Roger Batterbury, Chairperson, Health Watch Portsmouth.
Sarah Daly, Director of Children's Social Care and Education.
Alistair Snell, Deputy Chief Operating Officer, Southern NHS Trust.
Claire Jenkins, Portsmouth Police District Commander.
Jo York, Managing Director, Hampshire and Isle of Wight ICB and Portsmouth City Council.
Thank you very much, everyone. Very, very welcome to all of you today. Apologies for absence. We have Professor Anita Franklin from the University of Portsmouth, Francis Mullin from City of Portsmouth College, Diane Sherlock from AGK, Penny Emmerich from QA Hospital, and Councillor Vernon Jackson, Leader of the Council, will be late as he has a clashing meeting, but he will be joining us before the end of the meeting. Is there any other apologies for absence? No? Okay, thank you very much. Agenda item 2, any declarations of interest? None that I can see. Okay, so we move on to agenda item 3, minutes of the previous meeting held on the 22nd of June. Is everyone happy with those as a correct record of that meeting. Excellent. We'll take those as agreed. Okay. Number 4, we have the University of Portsmouth Medical School. So Professor Hoskins, over to you.
Thank you very much, and thank you for inviting me to brief you on the medical school project. So first of all, we're a small team that was pulled together in 2019 after in 2016 we decided not to bid for the new call for medical schools, because at that point we just reinvigorated our nursing programme and we really wanted to embed that and develop in some other areas of health and allied health provision before we felt we were ready to bid for a medical school. So we didn't bid at that time, and instead we worked our way through a strategic roadmap to be ready. And then in 2019, I was able to advise the Vice-Chancellor that we were ready to escalate a team and really focus on a medical school bid and being ready for any subsequent government call. That team is small, though. It's made up of John Person, the project manager, John Cookson, the medical school developmental dean, and John Cookson's actually developed and launched 5 medical schools before working with us, so he comes with a great pedigree. Teresa Martin, who is our curriculum lead. We have also 2 part-time clinical teaching fellows, Jim Riches and Lizzie Butler-Meadows. They are regional GPs. And we have Adam Feather, who is our admissions and assessment lead, and he's part of the senior team at the Isle of Wight Trust. We have a primary care champion, Donna Glide, and she's a GP in the region, and secondary care champion, Peter Brenham, who is a maxillofacial consultant at QA. We also have an external advisor, Chris Holland, who is the founding Dean of Kent and Medway Medical School, which was one of the new medical schools that had successful bids back in 2017. We also have lots of university staff, so for example, HR director, estates director, communications, marketing, advancement team, so existing members of staff like myself who have designated time on the medical school project team. So what is our goal? Our goal is to be ready by September 2024 to launch a graduate entry medical programme, often referred to as GEM. So essentially you take graduates onto your programme, and the reason we've gone for that is because we're really interested in widening participation, and it's much easier to take somebody who's done a degree rather than looking at A-levels, where you tend to get social deprivation factors impact A-level outcomes, and it's very competitive. Students with 4 A's might get onto a medical school, whereas somebody could get onto a degree with maybe 2 C's and a D, and then they prove themselves in their degree, and then we can take them into a medical school. The medical school would have no dissection and prosection. We'd be using technology to deliver high-fidelity anatomical learning. That's quite common now, and we're certainly experienced in simulation and tech med in education, so that's one of our kind of USPs that we'll be bringing. Will also be a problem-based medical school, and that means that the trainees are actually working in a much more high-fidelity mode, and rather than just sitting and watching others, they get involved, they work in problem-based teams. We'd be looking at 50 students initially, growing to 80 per year. It's a 4-year programme. Graduate medical schools are shorter than undergraduate medical schools. We'd be focused on making a major contribution to the regional health and workforce needs, so education, research, innovation, and creating a halo effect for the region. So, for example, the minute you have a medical school in the region, you get more doctor applications into GP services and into hospitals, because they then know their career has the chance of having an education element, which many do want at some point in their career. It would be focused on Portsmouth, South East Hampshire, the Isle of Wight and West Sussex geographical region. We'd be looking to create a lot of student intake from this region. The idea is that we try to grow our own, hence increasing HE participation rate in the region also, and looking to then retain those students in the region afterwards. So a lot of local student recruitments. There'll be a big outreach programme linked to this, starting in junior school age, and really developing those who think they might want to go into medical careers. Obviously, not all of them will go into the medical school, but the hope is then they would go into the health economy. We'd also be taking other students from other regions, but those who are interested in staying in the local region. And of course, we'd be taking a lot of graduates from this region, so they will also already be quite attached to the city. We know that a lot of students do stay in the region afterwards. For example, in our nursing programme, we have a much bigger intake of local youngsters and a much bigger stay rate after the programme. We also are looking at more diversity, so we really want to create a medical school that doesn't have the normal high tariff entry. We actually assess students in slightly different ways to come in, so there'll be very talented, able students, but there'll be more diversity that will better reflect the patients that they're treating in the region. The programme will also be more GP and community focused. Of course, graduates might want to go on to become consultants, but actually our shortage is in GP and community. So in order to make that happen, we'd have a lot more GP and community placement focus, and also integrated longitudinal placements, so they really get to know an area rather than just dip in and out. And we think that therefore will create a little bit more attachment to some of those placement areas. Interprofessional approach to education, another of our USPs at Portsmouth, would really be mirrored here. So for example, we'd have our physician associates working with our nurses and our medics, rather than having a very siloed medical school, because that is the future of the NHS. These students will need to be working in multidisciplinary teams. We really want strong partnerships with our healthcare trusts and primary care trusts. They're not just placement providers. This programme is developed in partnership, and to that end, we have the clinical advisory group and we have the partnership board. Our partners then, clinical partners, are PHUT, Southern NHS Trust, the Isle of Wight, regional GPs, and Solent NHS Trust as well now. We want community stakeholders also, so we're just in the process of developing a PPI group, patient and public interaction group. And all new medical schools need contingency partners, so an established medical school that will support you through the process of developing your school up to your first cohort of students graduating. And our contingency partner is Brighton Sussex Medical School. Very high in the league tables, really well-established medical school. We have a very good long-term relationship with them. So why do we need another medical school? We obviously have Southampton, a fantastic medical school for the region. Well, the Medical Schools Council, and this has very much been backed up by other bodies, the Royal College of Psychiatrists and the Royal College of Physicians, concur that we need 50,000 additional medics, whether those are for primary or secondary care. That means we need 14,500 additional graduating students per year. That would mean that all medical schools in the country would need to go up to the highest number of students, which is 250, 300, plus we'd need 10 new medical schools in the UK. So there is space for new medical schools. It is our belief that smaller, regionally focused medical schools can really support the health economy in a way that larger medical schools perhaps can't, where their students are going out to many different placements across a big region. We feel that doesn't necessarily create attachment. It means that medical school can't be focused on the needs of one region. So that's why we think we need a medical school in Portsmouth. Our motive then, why does the University of Portsmouth want to do it? Well, as you know, we are a civically focused university. Be under no illusion that you don't make money in medical schools. So we would be putting a lot of money behind this and investing an awful lot in this. But there is a bonus for us, and it's a halo effect for the university. Our reputation would build, and our other health areas would benefit by new buildings, by having more medics inform their courses, by better interdisciplinary education. Having medical students in that interprofessional education would really help. We would also probably recruit more students, and more and better staff by virtue of having a medical school. So there is something in it for us, but it is around the civic goals, and certainly we'd be investing our own money into this. So how are we doing? Well, we're working hard on 7 levels. Meeting the GMC, the General Medical Council's complex requirements for approval. It's an 8-stage process. Working on getting the placements ready, primary and secondary care. Curriculum planning with our partner. So our programme has to map onto Brighton and Sussex Medical School programme, because the idea of a contingency partner is if anything goes wrong, they continue to educate the students, so the programmes need to map. They're not a problem-based learning programme, so our education will be very different, but the outcomes have to be exactly the same. Potentially the assessment will be the same as well. We also have to work to meet the University of Portsmouth curriculum framework and quality assurance process. We have to realise our estate plan, so there's space for these students to go by September 2024. We have to really work up that very genuine community engagement, and we have to have funding to run. That's the critical point. So we would be ready by September 2024